Hi, welcome to today's session. We're going to be looking at administering subcut injections. So first things first, I'm going to sanitize my hands early on, ready for the gloves, because we all know that if we don't leave long enough it takes a bit of time. So what I want to do first is look at the CPG, which is the end of life care CPG, and it says here that as an EMT I can administer 5 milligrams IM or subcut midazolam for a patient who's feeling anxious and hasn't responded to opiates. So that's the CPG that I am using today. So I've checked my equipment and it's all in date, and the next thing I need to do is check the site where I'm going to give it, and as you can see on the video, these are the sites that we can administer subcut. Patient may have an idea of where they actually would prefer to have that medication given. So one of the things I need to do is check with our patient and just know that they understand why we're giving them the medication and get their consent for that. So I'd explain to the patient that the anxiety that they're feeling at the moment is not responding, but I'd like to give them a drug called midazolam just to help with that, and ask, are you happy that I give you that drug? And I will be administering it just under your skin via an injection. So the next thing we're going to do is check our drug. So I have midazolam and its expiry 10/22, and I've got 15 milligrams in 3 mils. Could you please check that for me?
I'm reading midazolam, 15 milligrams and 3 mils, expiring 10/22.
Thank you very much. So I'm giving 5 milligrams, which means I need to draw up 1 mil of midazolam. I have my 3 mil syringe here and my drawing up needle. Got my sharps available. And I'm just going to pop that on. So before I administer any medication, I do like to put a sticker on it, just saying what it is, keeping it clear of the numbers on the side, just in case for any reason I need to put this medication down. So I've got my medication, it has been checked, and just when you're opening an ampule, if there is a dot on the ampule, make sure that your thumb is on the opposite side to the dot. I like to always make sure that I'm not facing anyone as I pop that ampule, and I now have a sharp. I have removed my cover from my drawing up needle, and what I'm doing now is just drawing up just over 1 mil in this ampule, and then just making sure that the plunger is sitting on 1 mil. Once that's there, I can put the medication away and just recap my blunt. Normally we wouldn't recap a sharp, but a blunt's very hard to take off if you don't have the cap on it. So while I'm getting ready, I will be swabbing this patient's area. We wouldn't normally swab IM or subcut unless the patient was actually physically dirty or that they were immunocompromised, and because this is an end of life care guideline, we will do that swab. And you'll notice that all of this time I'm not putting this medication down. So we're going to, with a subcut, it's really important that we're actually pinching up the area so that we're not going into the muscle like an intramuscular, and we're going round in a circular motion. So I am now about to change out my blunt, and even though it is a blunt, it still goes in the sharp container. And so I'm about to give 1 mil, which is 5 milligrams of midazolam, and can you just check that for me? 1 mil?
Midazolam has 1 mil, and you're giving it under the CPG for palliative care for anxiety that didn't respond to opiates.
AFirm. So I'm now going to, again, sharps exposed, And this is an IM needle, so we're not wanting to go too deep into the skin, so we're grabbing that same area. pinching it in, administering the medication, taking it out immediately, sharps away, and we've now just given our subcut injection.